My name is Kathy, and I'm 38 years old, and I first started experiencing symptoms of irritable bowel syndrome when I was 15 in high school, and I was misdiagnosed with ulcerative colitis. Through that time, I was having mild symptoms, but then as I got older and I had a child, after the birth of my child, I began having severe symptoms of arthritis to where I could not walk and was actually bedridden. So what happened was I went to the doctor, the orthopedist, and they tested me for lupus, and everything was negative, and they quickly realized that I was misdiagnosed and I actually had Crohn's disease. So what happened was I found Dr. DeFelice and found out she was coming from Mayo to this university hospital. And I immediately sought her out, and she agreed to be my doctor. And as soon as I met her, she was fabulous. She went through the whole history of my disease and immediately wanted to do an endoscopy the next day. So within 24 hours, I was having a procedure done. I had all my blood work done. And when they wanted another test done, her nurse actually came to my house because I didn't have the supplies to have it done. So she came to my house that night and gave me all the supplies that I needed for that test to my house. It was the most excellent service I have ever had at a hospital. And they automatically set me up with a text messaging service. So if I'm ever having issues, I can text them immediately and they text me back. And it is just it is the best care I've ever had. I would recommend with patients who have IBD to stay in New Orleans and come to the University Medical Center because they have fabulous doctors who have come to the state-of-the-art center, and just like my doctor is able to help patients with IBD, and so that they don't have to go outside of the city, they can stay right here at home in New Orleans.